हाय गाइस, वेलकम टू आवर यूट्यूब चैनल। पार्ट वन में हमने डिफरेंट ऑर्गन सिस्टम पढ़े थे नर्वस सिस्टम तक, और इस वीडियो में जो है हम रिमेनिंग सिस्टम जो रहते हैं वो कवर करेंगे और सेंस ऑर्गन जो है वो भी कवर करेंगे। तो वीडियो स्टार्ट करने से पहले काइंडली हमारे चैनल को सब्सक्राइब करें ताकि ऐसी मज़ीद वीडियोस आप तक पहुंचती रहें। रिप्रोडक्टिव सिस्टम। Reproductive system is responsible for the production of offspring and continuation of the species. In males, the primary reproductive organs are the testes, which produce sperm and male sex hormones. Sperm are produced in the seminiferous tubules within the testes. The epididymis is where the sperm mature and are stored before ejaculation. The urethra serves as a passage for the both urine and semen in males. The penis is male reproductive organ used for sexual intercourse and the release of sperm. Testosterone is the primary male sex hormone responsible for the development of male reproductive organs and secondary sexual characteristics. In females, the primary reproductive organs are the ovaries, which produce eggs and female sex hormones. Ovaries are located on each side of the uterus and are connected to the fallopian tubes. The fallopian tubes are where fertilization of the egg by sperm typically occurs. The uterus or womb is where a fertilized egg implants and develop into a fetus. The cervix is the lower part of the uterus that connects to the vagina. The vagina is a muscular canal that connects the uterus to the outside of the body. Estrogen and progesterone are the primary female sex hormones responsible for the development of female reproductive organs and secondary sexual characteristics. The process of egg formation in the female is called oogenesis. The menstrual cycle is monthly cycle where the lining of the uterus is shed and an egg is released from the ovaries. Ovulation is the release of a mature egg from the ovaries, typically occurring in the middle of the menstrual cycle. Fertilization occurs when a sperm cell penetrates and combines with an egg cell, forming a zygote. The zygote develops into an embryo and eventually a fetus. Pregnancy is the period during which a fetus develops inside the uterus. The placenta is an organ that develops during pregnancy, providing oxygen and nutrients to the fetus and removing waste products. The umbilical cord connects to the fetus to the placenta, allowing for the exchange of nutrients and waste. Labor is the process of childbirth during which contractions of the uterus expel the baby from the mother's body. The mammary glands in the female breast produce milk for nourishing newborns. Lactation is the process of producing and secreting milk from the mammary glands. Infertility refers to the inability to conceive a child despite regular unprotected sexual intercourse. Contraception refers to the deliberate prevention of the pregnancy, commonly achieved through the use of birth control methods. Birth control methods include condoms, birth control pills, intrauterine devices IUDs, and hormonal implants. Human immunodeficiency virus, whom we call HIV, is a virus that attacks the body's immune system, leading to the acquired immunodeficiency syndrome, whom we call AIDS, if left untreated. Ovum or oocyte is the female reproductive cell or organ. It is the largest cell in the human body. Spermatozoa are the male reproductive cells or sperm. Ovum is the largest cell in the human body, especially in female, because ovum is only produced in the female. Second largest cell in the human body is nerve cell, or we call it neuron. A cesarean section, whom we call C-section, is a surgical procedure in which the baby is delivered through an incision in the mother's abdomen and uterus. Breastfeeding provides numerous health benefits for both the mother and baby, including the transfer of antibiotics and nutrients to the newborn. Menopause is a natural process that marks the end of women's reproductive years, characterized by a decrease in estrogen and the cessation of menstrual periods. तो मेनोपास में जो है एक नेचुरल प्रोसेस होता है जिसमें वुमेन प्रोडक्टिव सिस्टम जो है वो ख़त्म हो जाता है और जो मेंस्ट्रुअल पीरियड्स वो भी जो है वो नहीं आते. Andropause, often referred to as a male menopause, it is obtained or it is happens in male, is gradual decline in testosterone levels that occurs with the aging, leading to various symptoms such as fatigue and decreased sex drive. Now we see the respiratory system. We are just covering those one-liner GK which are commonly asked in different exams. The respiratory system is responsible for the exchange of gases, primarily oxygen and carbon dioxide, between the body and environment. It includes the nose, mouth, throat, larynx, trachea, bronchial tubes, and lungs. The primary function of the respiratory system is to facilitate the process of breathing, which involves the intake of oxygen and expulsion of carbon dioxide. The nose is primary entrance for air into the respiratory system and is lined with fine hairs and mucus to filter out dust and other particles. The mouth also serves as an entry point for air and can be used for breathing in the absence of nasal passages. The pharynx or throat is a muscular tube that serves as a passageway for both air and food. The larynx or voice box contains vocal cords and is responsible for producing sound and protecting the airway during swallowing. The trachea or windpipe is a tube that connects the larynx to the bronchial tubes and allows air to pass to and form from the lungs. The trachea is lined with cilia and mucus that trap and remove foreign particles and debris from the respiratory tract. The bronchial tubes or bronchi branch off from the trachea and extend into the lungs, where they further divided into smaller bronchioles. The bronchioles lead to tiny air sacs known as alveoli, where gas exchange occurs. The lungs are the primary organs of the respiratory system and are responsible for the exchange of oxygen and carbon dioxide. The right lung is divided into 3 lobes, while the left lung is divided into 2 lobes to accommodate the heart. The pleura is a membrane that surrounds the lungs and lines the chest cavity, providing protection and facilitating smooth breathing movements. Inspiration is the process of inhaling air into the lungs, while expiration is the process of exhaling air from the lungs. The diaphragm, as we already जो है हम पढ़ चुके हैं, diaphragm is dome-shaped muscle located at the base of the lungs that plays a crucial role in breathing process. The process of respiration involves 2 phases, external respiration and internal respiration. In external respiration, external respiration occurs the alveoli of the lungs, where oxygen is absorbed into the bloodstream and carbon dioxide is released from the bloodstream into the alveoli to be exhaled. Internal respiration occurs at the cellular level where oxygen is utilized by the cell for metabolic process and carbon dioxide is produced as a waste product. Hemoglobin is protein in red blood cells that binds to oxygen and carries it throughout the body. Hemoglobin is two-way respiratory carrier, transports oxygen from the lungs to the tissues and facilitating the return transport of carbon dioxide. Respiratory disorders can affect the normal functioning of the respiratory system and include conditions such as asthma, chronic obstructive pulmonary disease, we call COPD, and pneumonia. Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, leading to the difficulty breathing, wheezing, and coughing. Pneumonia is an infection that inflames the air sacs in one or both lungs, causing coughing, fever, and difficulty breathing. Tuberculosis, whom we call TB, is an infectious disease caused by bacterium Mycobacterium tuberculosis, which primarily affects the lungs and can lead to the symptoms such as coughing, chest pain, and fatigue. These are the symptoms of TB. Influenza or the flu is contagious respiratory illness caused by influenza viruses that can lead to the symptoms such as fever, cough, sore throat, and body aches. Bronchoscopy is a procedure that allows for the examination of the airway using a thin, flexible tube equipped with the light and camera, enabling the visualization, including the visualization of the bronchial passages and the collection of tissue samples for further analysis and diagnosis. Nebulizers and inhalers are devices used to deliver medication directly to the lungs, providing quick relief and long-term management of respiratory symptoms such as bronchospasms, wheezing, and shortness of breath associated with asthma, COPD, and other respiratory disorders. Every day, human body breathes in 10,000 to 15,000 liters of air. Now we are going to cover skeletal system. The skeletal system provides structural support, protection for vital organs, and facilitates movements in the human body. It is composed of bones, cartilage, ligaments, and tendons. Bones are living tissues that undergo constant remodeling and regeneration throughout life. There are two main types of bone tissues, compact bone and spongy bone. The human skeleton consists of 206 bones. There are 300 bones in newborn baby. The axial skeleton includes the skull, which it covers the brain, vertebral column, it covers a spinal cord and rib cage. The appendicular skeleton includes the bones of limbs, shoulder, and pelvis. Bones are classified into four kinds: long bones, short bones, fillet bones, and irregular bones based on their shape and structure. Long bones like the femur and humerus provide support and facilitate movement. Short bones like those in the wrist and ankle provide stability and support for weight bearing. Fillet bones such as those in the skull and ribs offering protection and serve as a site for the muscle attachment. Irregular bones like the vertebrae and hip bones have complex shapes and support various body functions. The biggest or longest bone in the body is femur, which is located in thigh. The smallest bone in the human body is the stapes bone, are located in the middle ear. Joints are the points where bones meet and allow for movement. There are different types of joints including fibrous, cartilaginous, and synovial joints. Fibrous joints like those in the skull are immovable and provide stability and protection for internal organs. Cartilaginous joints like those between the vertebrae allow limited movements and provide flexibility and support. Synovial joints like the knee and shoulder joints are freely movable and allow for a wide range of motion. Ligaments are tough bands of connective tissue that connects bones to the other bones, providing stability and limiting movements at joints. Tendons are strong fibrous cords that attach muscle to the bones, enabling movement and transmitting muscle force to the skeleton. Bone marrow is a soft gelatinous tissue found inside the hollow spaces of bones, producing blood cells and storing fat. Red bone marrow is responsible for the formation of RBC, WBC, and platelets. Yellow bone marrow consists primarily of fat cells and serves as an energy reserve for the body. Calcium and phosphorus are essential minerals for bone health, providing strength and structure to the skeletal system. Vitamin D plays a critical role in calcium absorption and bone metabolism, promoting bone mineralization and reducing the risk of bone-related disorders such as rickets. So, deficiency in vitamin D causes rickets and osteomalacia, and individuals with vitamin D deficiency or inadequate sun exposure. The main source of vitamin D is the sun. Ossification is a process of bone formation. Bones in the skull are 22. Bones in the eye are 7. Bones in the each foot are 26. Bones in each hand are 27. Bones in face are 14, whom we call facial bones. There are 12 pair of ribs, or we can say 24 ribs. There are 3 bones in each ear. Now we will study urinary system. The urinary system, also known as renal system, is responsible for filtering and eliminating waste products from the body. It consists of kidneys, ureters, bladders, and urethra. The kidney are bean-shaped organ located on either side of the spine below the rib cage. Each kidney is composed of millions of functional units. We call it nephrons. Nephrons are responsible for filtering blood and producing urine. The ureters are narrow tubes and transport urine from the kidney to the bladder. The bladder is a muscular sac that stores urine until it is expelled from the body. The urethra is a tube that carries urine from the bladder to the outside of the body. The main function of the urinary system is to maintain the body's fluid balance and eliminate waste products such as urea and excess salts. The kidneys play a crucial role in regulating blood pressure by controlling the volume of blood and concentration of sodium and potassium. They also help in production of RBCs by secreting the hormone erythropoietin. The process of urine formation involves filtration, reabsorption, and secretion. Filtration occurs in the glomerulus, a network of capillaries within the nephron. Reabsorption involves the absorption of useful substances such as water and glucose back into the blood stream. Secretion involves the removal of additional waste products and substances from the blood into the urine. The composition of urine includes water, urea, uric acid, creatinine, and various electrolytes. That is why urine is the best conductor. You might have seen in 3 Idiots. The average adult produces about 1 to 2 liters of urine per day. The color and composition of urine can produce insights into a person's health and hydration status. जो यूरिन का कलर होता है और कंपोजिशन होता है उससे पता चलता है कि पर्सन की जो है वो हेल्थ क्या है या उनको कौन सी बीमारी है. Urine is typically sterile when produced by the kidneys. Kidney stones are hard deposits that form in the kidneys and can cause severe pain when passing through the urinary tract. Dehydration, certain dietary factors, and genetic predisposition can contribute to the formation of kidney stones. Symptoms of kidney stones may include severe pain in the back, side, or groin, as well as blood in the urine. Renal failure is a condition in which the kidneys lose their ability to function properly, leading to buildup of waste products and fluids in the body. Acute renal failure can occur suddenly, often as a result of injury or severe infection. Chronic renal failure develops over time and is often associated with conditions such as diabetes and high blood pressure. Dialysis is treatment that helps to filter and purify the blood in cases of kidney failure. Kidney transplants are another treatment of option for patients with end-stage renal disease. The transplanted kidney can come from living or deceased donor. The female urethra is shorter than the male urethra, which increases the risk of urinary tract infections in females. The average length of kidney of men is 10 to 13 centimeter. Now we will cover, now up to this moment we have covered all the systems. अब जो भी रह जाता है जैसे कि टीथ के बारे में या सेंस ऑर्गन्स जो है ह्यूमन बॉडी में रह जाते हैं तो बकाया हम वो कवर करेंगे. इससे क्या होता है कि हमारी बॉडी के ह्यूमन बॉडी के जो है वो सब वन लाइनर जो है वो कंप्लीट हो जाएंगे जो डिफरेंट एग्जाम में पूछे जाते हैं हमसे. टीथ are hard mineralized structures found in the mouth of humans and many other animals used for biting, chewing and processing food. टीथ को जो है वो हम स्केलेटल में भी कवर कर सकते थे या फिर हम डाइजेशन में भी कवर कर सकते थे बिकॉज यू नो दीज टीथ आर द पार्ट ऑफ बोथ द सिस्टम्स. Human have two sets of teeth in their lifetime. The primary teeth, also known as baby teeth, or we call it milk teeth. The permanent teeth, and second one are permanent teeth, which replace the primary teeth as a person grows. There are 32 teeth in adult human mouth. Primary teeth, we call it baby teeth or milky teeth, are 20. There are normally 4 wisdom teeth, 2 in upper jaw and 2 in the lower jaw. But some people have more, fewer or even none at all. Wisdom teeth, part of molar teeth, usually erupt or grow during 17 to 30 years age. Wisdom teeth जो है वो इस एज में आते हैं 17 से 30 साल की एज में आते हैं. There are 4 different types of human teeth: incisors, canines, premolars and molars, each with a specific function in the chewing and grinding of food. Incisors are the front teeth used for cutting and biting into food. Canines are the pointed teeth that help tear food and are responsible prominent in the carnivores. ये इंसाइजर जो हैं वो फ्रंट वाले जो दांत होते हैं ना हमारे जो फ्रंट पे होते हैं वो होते हैं जैसे कि फ्रंट में 4 होते हैं, अपर जा में 4, नीचे भी 4 होते हैं. और कैनाइन्स उसके पास वाले होते हैं ना, जो इंसाइजर के पास वाला जो दांत होता है उसे कैनाइन बोलते हैं. दोनों तरफ होता है, 2 नीचे जा में 2 ऊपर वाले जा में. प्रीमोलर्स and molars are larger flatter teeth located in the back of the mouth. ये पीछे होते हैं, designed for grinding and crushing food into smaller, more easily digestible pieces. Enamel is the hardest and outermost layer of the tooth, providing protection and strength. It is strongest substance in the human body. Remember it, enamel is the strongest substance in the human body. Dentin is the layer of tooth beneath the enamel, providing it with the support and structure. The pulp is the innermost part of the tooth, containing nerves, blood vessels, and connective tissues, essential for the nourishment and sensory function of the tooth. देखें ये स्ट्रक्चर होता है, ये फ्रंट वाले इंसिजर्स होते हैं, ये वाले ये चार ये और चार जो है हमारे बिल्कुल ऊपर होते हैं, ठीक है। और ये पास वाला जो कैनाइन टीथ होता है, ये वाला और ये वाला, और इससे बैक वाले दो दांत, दो इस तरफ दो इस तरफ, चार, ये हो गए चार, चार ऊपर, आठ प्रीमोलर्स हो गए। और रिमेनिंग ये जो है रिमेनिंग जो है वो कौन से हो गए हमारे, मोलर टीथ हो गए, ठीक है। मोलर टीथ, विजडम टीथ इज अ पार्ट ऑफ मोलर टीथ, ठीक है। जो एंड वाला होता है, एक यहाँ होता है एक यहाँ होता है विजडम टीथ, दो नीचे वाले जा में, दो ऊपर वाले जा में, ठीक है। ये चार हो गए। Cementum is specialized bony substance that covers the tooth root, providing support and helping to anchor the tooth into the jawbone. Dental caries, commonly known as tooth decay or cavities, occur when bacteria in the mouth produce acids that dissolve the tooth enamel and dentin. Poor dental hygiene and sugary diets can increase the risk of dental caries and other oral health problems. Maloclean refers to the misalignment or incorrect positioning of the teeth, which can lead to the difficulties in chewing, speaking and maintaining proper oral hygiene. जो दांत आगे पीछे हो जाते हैं तो उसे हम बोलते हैं maloclean. Orthodontic treatments such as braces and aligners can help correct maloclean and improve the alignment and appearance of the teeth and jaw. Now we'll cover sense organs. Sense organs are specialized structure within the body that enable the perception of sensory information from the environment. They play a crucial role in allowing organisms to respond to various stimuli. सेंस ऑर्गन्स जो हमने कवर पीछे नहीं किए वही हम करेंगे इसमें। पहले हम देखते हैं आईज। द ह्यूमन आई इज एन ऑर्गन दैट डिटेक्ट्स लाइट एंड अलोज फॉर विजन, प्रोवाइडिंग द सेंस ऑफ साइट, डेप्थ परसेप्शन एंड कलर परसेप्शन. The eye works similar to the like camera with the lens that focuses light onto light sensitive layer called retina. Film is the part of camera which is analog to the retina in human eye. Like film the camera, similarly retina in the human eye. The human eye forms the image of an object at its retina. The image formed on the retina is real and inverted. The cornea is the transparent outer layer of the eye that covers the iris and pupil, helping to focus light onto the retina. The iris is the colored part of the eye that controls the size of pupil, regulating the amount of light that enters the eye. The pupil is the black circular opening in the center of the iris that allows light to enter the eye. The lens located behind the iris further focuses light onto the retina, allowing for clear vision at different distances. The retina is a layer of tissue located at the back of the eye that contains photoreceptor cells, which converts lights into the electrical signals that are sent to the brain through the optic nerve. The optic nerve transmits visual information from the retina to the brain, allowing for the perception and interpretation of visual images. The sclera is the tough white outer layer of the eye that helps maintain the shape of the eye and protects the delicate inner structures. Tears are essential for maintaining the eye health and vision. Blinking helps spread tears across the surface of the eye. The aqueous humor is the clear fluid filling the space in front of the eyeball between the lens and cornea. The vitreous humor is the clear gel that fills the space between the lens and retina. Lacrimal gland which secrete tears. The visual cortex in the brain processes visual information received from the eyes, allowing for the perception of shapes, color, depth and motion. The human eye has resolution of 576 megapixels. The ability of the eye to see in the dark is due to the production of purple pigment known as retinine. When a person enters a dark room from bright light, he cannot see anything clearly for some time. Slowly he starts seeing things. This is because of iris contracts. ये सवाल जो है वो इस तरह भी पूछा जाता है या दूसरे केसेस में इस तरह भी पूछा जाता है. मैंने वो तीनों केसेस यहाँ पर आपके लिए लिखे हुए हैं. When a person walking in the bright sunlight enters a dark room, he is not able to see clearly for a little while because the iris is unable to dilate the pupil immediately. और इससे भी पूछा जाता है when we are in bright light the pupil contracts to allow adequate amount of light sufficient for visibility, but as we enter a dark room the amount of light passing through the pupil is not sufficient to assist visibility, so our pupil expands. तो pupil जो होता है आंख का वो expand हो जाता है. During an eye transplantation the damaged or deceased cornea is typically replaced with healthy donor cornea. आई ट्रांसप्लांटेशन में पूरी आई नहीं होती ट्रांसप्लांट, सिर्फ जो कॉर्निया है वो ट्रांसप्लांट होता है. ठीक है. मायोपिया इज नियर साइटेडनेस वेयर डिस्टेंट ऑब्जेक्ट्स अपीयर ब्लरी. जो दूर वाले जो ऑब्जेक्ट्स होते हैं वो थोड़े से धुंधले नजर आते हैं. मायोपिया इज एसोसिएटेड विद elongation ऑफ द आईबॉल. आईबॉल जो है elongate हो जाता है which alters the way light focuses on the retina resulting in blurred vision for distant objects. Myopia nearsightedness can be corrected by using concave lenses. Hyperopia hypermetropia जिसे हम far sightedness बोलते हैं या long sightedness भी बोलते हैं where close objects appear blurry. जो पास वाली जो चीज़ें हैं पास वाले जो objects है वो जो हमें धुंधला नजर आता है. Hypermetropia or long sightedness occurs when the eyeball is too short. ठीक है. Or the cornea has little curvature causing light to focus behind the retina instead of directly on it. This results in difficulty seeing objects up close. It can be corrected using convex lenses. Long sightedness can be corrected by using convex lenses. Color blindness, also known as color vision deficiency, is a condition characterized by the inability to perceive certain colors, particularly red and green. Protanopia is a severe type of color blindness that causes the inability to perceive any red light. Deuteranopia is the inability to perceive green light. Tritanopia is a rare type of color blindness that affects the perception of blue light. Now we'll cover one-liner on ear. The human ear is divided into three main parts: the outer ear, the middle ear, and the inner ear. The pinna or auricle is the visible part of the outer ear that collects sound waves and directs them into the ear canal. The ear canal is a tube-like structure that carries sound to the eardrum. The eardrum or tympanic membrane separates the outer ear from the middle ear and vibrates in response to sound waves. The middle ear contains three small bones known as ossicles, which transmit and amplify sound vibration from the eardrum to the inner ear. The three ossicles are named the malleus, hammer जिसे बोलते हैं, incus, anvil जिसे बोलते हैं, and steps या stirrup भी बोलते हैं. The eustachian tube connects the middle ear to the back of the nose and help equalize pressure between the middle ear and the environment. The inner ear contains cochlea, the semicircular canals, and the vestibule, which are responsible for hearing and balance. The shape of the external ear is due to elastic cartilage. Hearing process. First of all, sound waves enter the outer ear and travel through the ear canal to the eardrum. The vibration of the eardrum causes the ossicles to amplify the transmit the sound waves to the inner ear. Within the cochlea, hair cells convert the mechanical energy of the sound vibrations into the electrical signals that are sent to the brain. The auditory nerve carries these electrical signals from the inner ear to the brain for processing and interpretation. Frequencies between 20 Hz to 20,000 Hz make up audible range for the most humans. The normal audible range for loudness is from 0 to 180 decibel, but anything या any जो है कोई भी आवाज़ over 85 decibel can be damaging. Now we'll cover taste buds. Taste buds are located on the tongue and other parts of the oral cavity, including the roof of the mouth and the back of the throat. There are 5 primary taste sensations that taste buds can detect. Sweet, sour, salty, bitter, and umami or savory, we call it. Taste buds are housed within small bumps on the tongue called papillae. Taste buds have relatively short life cycles, typically lasting around 10 to 14 days, after which they are replaced by new taste buds. Taste receptor cells send signals to the brain where the perception of taste is processed and interpreted, allowing individuals to distinguish various flavors and respond to different tastes. Sensitivity to different tastes can vary with age, with children often exhibiting greater sensitivity to sweetness and a lower sensitivity to bitterness compared to the adults. The average human tongue has 10,000 taste buds. The taste buds for sweet are on the tip of the tongue. जो मीठे के लिए जो होते हैं टेस्ट बर्ड वो टिप ऑफ द टंग पे होते हैं, while salt taste buds are the either side of the front of the tongue, बिल्कुल सामने होते हैं स्वीट के टेस्ट बर्ड के पास में. स्वर टेस्ट बर्ड्स आर बिहाइंड दिस, स्वर से पीछे होते हैं. बिटर टेस्ट बर्ड्स आर वे इन द बैक. देखें ये जो टिप ऑफ द टंग पे स्वीट होता है, साल्टी अदर साइड ऑफ द टंग होता है, और स्वर जो इससे पीछे होता है यहाँ पर, और बिटर जो है बिल्कुल पीछे जो है यहाँ टेस्ट बर्ड होते हैं, और ये बीच में जो मामी जो है सेवर जो होता है टेस्ट होता है. ठीक है, तो ये था, हमने ह्यूमन बॉडी पे जो है वो सारे वन लाइनर देखें, और नेक्स्ट में हम देखेंगे कार्बोहाइड्रेट्स, प्रोटीन्स, विटामिन, फैट पे वन लाइनर देखेंगे. उम्मीद करता हूँ मेरी वीडियो आपको पसंद आई होगी. थोड़ी सी लेंथी हो गई, लेकिन मैंने कोशिश की कि इसको मैं जो है वो 2 पार्ट में ही कवर कर सकूँ, ज़्यादा लेंथी ना हो पाए. जैसे आप ये वन लाइनर पूरा देखेंगे, उम्मीद करता हूँ कि कोई भी एग्ज़ाम हो, आप ह्यूमन बॉडी के रिलेटेड कोई भी MCQ या कोई भी सवाल आप इजीली कर सकते हैं. तो मिलते हैं अगले वीडियो में. अपना ख्याल रखना. सी यू, टेक केयर.